social distancing when you are used to safeties in numbers, you can imagine how quickly the potential for this virus to spread is.
Concerns about outbreaks within the homeless population, where safety protocols like social distancing are harder to maintain, are starting to materialize after 2 people here at the Calgary Drop-In Centre's main homeless shelter were sent to hospital after testing positive for COVID-19. A 3rd case has also been confirmed. The drop-in center is taking new steps, making it mandatory for everyone in the building to wear masks at all times and denying access to anyone who has tested positive or are suspected to have COVID-19, directing them to alternate designated spaces. The province has been working on that since the start of the outbreak, providing funds to help open 14 new shelters and get access to hotels and housing.
Since March, shelters and community-based organizations have collectively housed more than 400 people.
Ultimately, housing is the solution to end homelessness. And I think that where we're also, where we could do better on is taking people out of emergency shelters and doing things like using hotel rooms.
Alberta Health Services is also taking steps to start testing asymptomatic people in homeless shelters.
We've already had a testing protocol in place since even before we've had a positive test case, and we'll continue to have that same protocol.
And while housing and transmission have been concerns for homeless people since the start of the outbreak, a new challenge, which is just as serious, is becoming more widespread.
The primary request is for food. People that were able to panhandle previously are not able to. There's no one walking the streets, so they can't secure these funds. So even if they do find money, they're not able to access a lot of the McDonald's. Tim Hortons, for example, are shut down in the downtown core. And they, of course, can't go inside of the shelters unless they are clients of that shelter.
In Calgary, Jonathan Muma, City News.